Mr. Thompson from California is recognized for 4 minutes.
Thank you, Mr. Chairman. Mr. Secretary, thank you very, very much for being here. I want to revisit some of the things that the chairman had mentioned. It seems to me incongruent to be for protecting people with pre-existing conditions and to sue to do away with the protections for pre-existing conditions. And the lawsuit that has been referenced already today would do more than just that. It would preclude people from being able to keep their kids on their plan. It would end health care for 20 million Americans, and it would affect how we deal with people with mental illness. And the issue of mental illness is so profound. It's found in our addiction problems, in our homeless problems, in our law enforcement. Our jails are filled with people with mental illness. And the Affordable Care Act was the first time that we ever put mental health on par with physical health. And to sue to do away with this and at the same time propose a budget with $844 billion in cuts, I find very difficult to believe that it's going to do anything but worsen our health care problems. And we've yet to see anything written that suggests that the administration has a plan to deal with health care. Is there a written proposal? We were promised that this president was going to repeal the Affordable Care Act and replace it with something even better. Is there a written plan for that?
So we've put in the budget the $844 billion allowance that would be for us to work together with Congress in a flexible way. We're trying not to stake out a firm demand around the approach that would replace the Affordable Care Act there so that we have flexibility to work together. We can see the composition of Congress. But frankly, right now, it is so far off that we would see any Supreme Court decision and how it would rule. Any plan, any document, any notion like that would be so hypothetical and distant as to be meaningless.
Thank you, Mr. Secretary. But if that's your position, that the court case is going to take a long time to settle, why don't you just work with Congress now to improve the Affordable Care Act?
So that's exactly what the $844 billion allowance is there for. That would actually be reforming of the Medicaid expansion, reforming of the individual market approach. So we are open to working with you on ways in which we can provide better health care for the American people.
Well, I don't know how you can improve health care at the same time you're proposing to cut it by $844 billion. On the issue of the coronavirus, Mr. Secretary, one thing that I'm especially concerned about is that we're running out of isolation wards. Patients with coronavirus need to be held in isolation, and right now they're being sent to wards at acute care hospitals. I know folks in my district are concerned. What are we doing about that?
I actually really appreciate you raising that question. So we are right now in a very active containment mode. And so that means an individual who tests positive for coronavirus, we're putting them into these types of Ebola-like isolation units that will look very extreme. That is not what's indicated medically for these individuals. Most individuals who get this coronavirus will have mild to moderate symptoms, will be able to stay home and treat it like the flu or a severe cold and present at a hospital only for urgent care or comorbidities. So it's really important we correct this impression that it will require this massive hospital isolation for normal patients. We're in containment mode right now to stop any further spread, but if we end up having broader spread, it will be a much more common approach. As Dr. Shook had called it, it will look and feel to the American people more like a severe flu season in terms of the interventions and approaches you see. So thank you for helping me to clarify that for folks.